Hi, my name is Cody Jussel. I am the founder of Santa Cruz Biomechanics, located in Santa Cruz, California. I am a corrective exercise specialist working with Liberty Rising to give you a couple good ways to mobilize your hips. Something that we tend to lose when we do lots of sitting is mobility in our hips, right? And these joints, the architecture of the hip joint is meant for mobility. So as we start to lose mobility in the hips, our body is going to try to find and make up that mobility in some other way. Usually, we start to become more mobile in our low back, our lumbar spine, and the architecture of those joints really creates stability, right? So we just want to maintain the mobility of the hips so that our brain knows that our low back needs to remain stable. And then, we can kind of think about the joints up and down the body as following that same pattern. They're either going to crave mobility or crave stability, one or the other generally. So we're going to focus on the hips today. So what you are going to do is sit yourself down on the floor somewhere and put one leg folded in front of you, one leg folded behind you. If this is an exceedingly difficult position to sit in, go ahead and put like a yoga block underneath your buns, or a pillow or a bolster or anything like that, and that should lift you up enough to take some pressure off of your knee joints and to allow you to sit both of your sits bones, like the bottom of your pelvis, directly down onto that elevated surface, right? If you get on the floor and you can do this and it's no problem, awesome, you just stay here. Your knee in the front particularly does not have to touch the floor. And if it's a little bothersome on your knees or you feel pressure in your knee joint, right, you can open up that angle at the back of your knee by moving the front foot forward and by moving that back foot just a little bit further out, so you've got just a little bit more openness in the back of the knee. That tends to be more comfortable. Otherwise, it's kind of like sit in whatever way makes you feel good, trying to mimic as close as you can get to this 90-90 position. So then what you're going to do is you're going to take the hip that's associated with the leg that goes behind, you're going to press that hip up and forward, right? As if you were going to turn your whole body to the right, but you're not going to. You're going to go up and forward just with the pelvis, and then back and down. And you're going to do it again, right? And you kind of get the sensation of your thigh bone moving inside the hip socket, right? You can even put a hand on your hip, right? And make a little C shape with your hand, cup around your hip, right where your thigh bone kind of meets your pelvis, where you feel like that's happening. And just feel what's going on there, right? You might get into this position and start doing this thing and be like, whoa, my legs, my pelvis, they don't move very much, right? It's okay. That's a pretty normal feeling to have when you start to do this, right? But by the end, you should feel that there is a change, right, in that joint. We're not necessarily looking for any particular end goal. We're just looking for a little bit of change from where you started. So wherever you start is fine, right? And then you're going to end up in just a little bit of a different place. So that's kind of all we're looking for, right? So right now, you're just communicating to your brain that you want a little bit more mobility here, right? And if it feels good, you're going to take that rotation into your upper body. Maybe put your hands on the right side of your forward leg or on the outside of your forward leg, depending on which leg is forward. And then you can bring it all back around. Right? Same thing again. And bring it all back around. We're going to do the same thing on the other side, right? So opposite leg is going to go forward, and then the opposite leg is also going to go back. And when you get over here, you might be like, whoa, this side is way different from the other side. Again, 99.9% of humans feel this way, right? That one side is going to be different from the other. Very natural feeling. We're going to do the same thing. I absolutely feel that this hip is a little bit different than the other hip, feels a little bit tighter, right? It's just something to note and like file away in your brain and be like, oh yeah, my hips function a little bit differently. Very, very normal, right? We are one-sided creatures, right? We're either right-handed or left-handed, or we're truly ambidextrous, which amazing if you are, that's incredible. But that one-sidedness is going to create asymmetries in the body. It's a very natural thing to live with. Sometimes those asymmetries cause pain, and sometimes they don't, right? But this is a good way to just kind of recalibrate each side and get as much mobility out of each hip as you can. Good. And then you're going to take it into a full upper body rotation, right? You can use your hands on the floor and maybe even against your leg to create a little bit of traction, to dive a little deeper maybe into that rotation. Good. Something that you want to think about as you're doing this is breath, right? There is a really great breathing video that Liberty Rising already has up on their page. If you're looking for some sort of guided breath, watch that video and then you can apply that video to what we're doing here. Breath is extremely important to our movement, helps to calm our nervous system, and it helps to open our sensory motor system, which is a fancy way of saying your brain and your body, right, and how they communicate. It opens our sensory motor system to receive new information if we're already in that rest and digest parasympathetic nervous system. So be sure to check that video out, watch that video, then come do this video. And you'll have some nice mobile hips, a little bit more than they started with, a little bit more mobility than they started with. Thank you for joining me, and have a beautiful day.